Preview.
Cancer and Scuba Diving, What Divers Need to Know, by Dr. Nicholas Bird. Few words strike fear quite like cancer. But what exactly is it, and how might it impact decisions about medical fitness to dive? Cancer is a broadly applied term used to describe cells that exhibit abnormal and unregulated replication, growth, and activity. Typically, the term cancer itself is reserved for growth that actively invades adjacent or distant tissues. These aberrant cellular behaviors can arise from spontaneous changes in DNA, or they may stem from environmental factors that disrupt DNA and impact normal cellular function. When this occurs, cells can lose the ability to control growth and may even become resistant to normal programmed cell death. By way of analogy, cancerous cells are therefore essentially corrupted, rebellious, and immortalized cells that have become socially irresponsible to the point of compromising other cells, tissues, and ultimately the life of the host. Tissue masses that form as a result of unchecked proliferation are commonly called tumors or neoplasms, that is, new growths. If there is a genetic basis for neoplasm, the altered DNA can be passed to daughter cells, which then multiply and spread. Cancer's capacity to impact health systems stems from these alterations in cell activity, which may interrupt or disrupt normal organ function, and do so sufficiently to cause illness. Cancer is the second leading cause of death in the United States. The American Cancer Society published that in 2013 there were an estimated 1.6 million people affected with cancer. With statistics like these, it's likely that someone you know has been affected or will be. Neoplasms can be described as being either benign or malignant, and these designations are based on their behavior. Benign tumors generally remain localized to their site of origin, and most develop a fibrous capsule that separates them from the surrounding tissue. This makes it easier to remove them surgically. While such tumors usually don't spread beyond their site of origin, the nature of their size and location can still cause them to act in a malignant way. For instance, a benign tumor in the confined spaces of the skull may be every bit as lethal as a malignant counterpart. Malignant tumors are referred to most commonly as cancers, and the malignancy description implies that the tumor invades adjacent tissues and destroys their structures. While not all malignant tumors behave in the same way, they all warrant some concern. The infiltrating nature of these tumors generally prompts more aggressive treatment, which may include a combination of chemotherapy, radiotherapy, and surgery. Diagnosis is best when done early, and for this reason, screening programs have been implemented to detect a number of cancers at early stages. These include examinations such as mammograms, cervical cytology, previously known as Papa-Nicolau or Pap smears, and colonoscopies. To demonstrate the thought process and methodology of these screening approaches, let's take a look at colon cancer, which is the second leading cause of cancer death in the United States after lung cancer. The United States Preventative Service Task Force recommends screening for colon cancer at the age of 50 and continuing every year for 10 years until about the age of 75 for people with average risk. Colonoscopy enables detection of colon cancer as well as the discovery and removal of early precancerous growths. Commonly beginning as small benign lumps called adenomatous polyps, these tumors may be visible in the inner lumen of the colon. Colonoscopy enables direct visualization of the inner lining, and the camera lens is a flexible tube that also allows tissue sampling or biopsies to be taken. Further microscopic evaluation by a pathologist is then necessary to confirm whether or not the biopsy is normal or neoplastic. Typically, the first thing a patient wants to know after being diagnosed with cancer is, has it spread, and what is the expected outcome or prognosis? To help provide a framework for such discussions and to guide treatment, early medical and surgical efforts are geared towards determining the so-called grade and stage. A tumor's grade is the measure of its cellular abnormality or the degree of differentiation from its original tissue type. In other words, how weird does it become? Whereas staging is based on the size of the tumor and the extent of the local invasion. In other words, to lymph nodes or into distant areas of the body. Grade and stage are determined using techniques including clinical findings, microscopic evaluation of biopsy tissue, cytology, computer tomography, positron emission tomography or PET, magnetic resonance imaging or MRI, as well as surgical exploration. Current treatment modalities fall into 4 basic categories: surgery, chemotherapy, radiation, and bone marrow transplantation. The specific therapeutic approach to a given cancer is influenced by many factors, including its size, grade, stage, location, tumor genetics, which may influence the tumor's type and sensitivity to treatment, the likelihood to success, the risk of treatment, and the probability of reoccurrence. Treatment modalities are often provided together or in sequence to achieve remission, to reduce a tumor's impact on health, or to simply surgically remove it. Surgical removal of abnormal tissue is often the first-line treatment, and it can enable both the gross and microscopic removal and evaluation of tissue. Excision of wide margins of normal-appearing tissue is usually the best way to increase the chance of complete removal of cancer cells. The idea is to minimize the chance of spread or metastases and local recurrence. This approach is not appropriate in all cases and is affected by the tumor type, location, and the degree of metastasis. Tumors located in vital organs such as the brain, lungs, and liver offer additional challenges for surgical removal, as their removal may be life-threatening as a result of the surrounding tissues that are affected. Some cancers, such as those involving bone or blood marrow, are not amenable to surgery as such, due to the widespread nature of the tissue, and in these cases, chemotherapy or radiation would be used. Chemotherapy refers to the use of so-called cytotoxic or cell-toxic drugs in an effort to stop tumor growth. The type of chemotherapy that's used and its duration may vary. The agents are typically delivered systemically to not necessarily only target tumor cells. However, cancer cells are usually more vulnerable to the chemotherapeutic agent, and this characteristic is what is exploited when providing chemotherapy. In other words, that it will be more toxic to the tumor cells than it will be to the other cells of the body. The side effects of chemotherapy may include fatigue, nausea, bleeding problems, diarrhea, lowered stamina, hair loss, and immunosuppression. Some agents may cause lung damage as well as heart damage. Newer agents are arising that are not as cytotoxic. One of the examples is the use of so-called monoclonal antibodies, which target specific proteins on tumor cells and deliver the chemotherapeutic agents more directly to these cells. Radiation. Radiation therapy focuses high-energy ionizing radiation to kill cancer cells. It impacts the DNA directly and thereby reduces the ability of cells to divide, leading to mass cell death. Again, it is delivered primarily to the tumor site, but has effects on other normal tissue as well. The idea is to have the greater effect on the tumor, but it can cause acute tissue damage to the immediately adjacent tissues and also longer-term breakdown of tissue, which may only become evident months or even years later. Bone marrow transplantation. For certain cancers, bone marrow transplantation may be used. In these situations, patients undergo bone marrow destruction initially, which kills off the cancer cells as well as healthy marrow, followed by the transfer of marrow stem cells from a patient or donor, which is then transplanted with the goal of producing cancer-free bone marrow cells. Connection to diving. It's important to state that diving as such is not associated with either promoting or enhancing cancer growth as such, but the medical fitness of an individual who is suffering from cancer may vary significantly. There are unique considerations related to brain, lung and colon cancer that may be necessary in the case of diving. So in conclusion, people with cancer may be medically cleared to dive, provided their health status is commensurate with the strenuous activity of diving and the cancer's location. In other words, that this does not place them at elevated risk of injury in conjunction with diving. Divers with a recent history of cancer treatment should complete all their therapy, allow sufficient time for rehabilitation, and then be medically cleared to return to diving, preferably by a diving physician.